Hi, my name is Dr. Igor Tabrizian. I'm a qualified medical doctor with a background in integrative and preventative health. On this channel, I'll explore evidence informed approaches to optimize well being from nutrition, gut health to hormones, energy, and everything in between. Please note, this information I share is general in nature and not intended to be used as medical advice. Always consult your own healthcare professional before making any changes to your health routine. Hello again. Welcome to the nutrient stream of my channel. And today I'm going to be talking about iron deficiency. Now, I'm going to do another talk just on iron and another talk just on iron overload. But today, considering how common this is, I thought I would talk about it. Apparently, about 12% of the global population is iron deficient. And that's mostly women and children. So, the symptoms that you might get from the iron deficiency, here are some of them: fatigue, persistent tiredness and lack of energy, and unrefreshed sleep. Typically, what my patients say is they get aliquots of 90 minutes of sleep and then they wake up and they turn over, toss, go to the loo, then they get another 90 minutes and another 90 minutes instead of getting one long block of 8 hours. Second symptom, weakness, generalized weakness and reduced physical strength. And that's because the iron is actually in the muscles as well as the bloodstream. More on that later. But iron deficiency can cause symptoms way before anemia. Unfortunately, there's still medical people who don't get that distinction. Pale skin, it's because iron is needed to make the pigment melanin. Shortness of breath, difficulty breathing or feeling breathless, especially during physical activity. Again, symptoms like this can precede the anemia by about 4 years. Dizziness, especially when standing up quickly, that's probably because iron is needed to make noradrenaline, which is important for maintaining your blood pressure when you change posture. Cold hands and feet, and in fact, feeling cold all the time is one thing, and it's because they don't have enough iron for their mitochondria to raise the core temperature enough to keep the periphery warm enough. Headaches, that's probably a lot more common a cause of headaches than what you might think. Brittle nails, poor appetite, and restless leg syndrome. So that's a pretty good list of 10 symptoms of iron deficiency. Now, iron is an interesting element if you're interested in that sort of thing. It has an atomic number of 26. And as you may or may not know, we and this whole planet is made from the ashes of dead stars. So these minerals, hydrogen, carbon, oxygen, iron, all of those were created when a star or more than one star exploded, and those minerals were scattered in the wake of the supernova. Now, what happens with stars is that they start with a particular simple element, and as they progress over time, they get more and more complicated. So it's a bit like stacking, more electrons, more protons, more neutrons. And it turns out that the lifespan of a star, say for 25 solar masses, for 7 by 10 to the 6th years, all it does is join two hydrogen atoms to make helium. And then the next 7 by 10 to the 5 years, you're converting helium to carbon. Then the next 600 years, you're converting carbon to oxygen. Then for 6 months, you're converting oxygen to silicon. And the last thing the star ever does before it dies is make iron. So iron production by stars is kind of the death knell. And the lifespan after that can be a day or seconds or fractions of a second. So the iron, as the element that has killed off the star, ironically, is the iron that gives us life and allows vertebrates in particular to do what they want to do. So with most elements, there's different forms that they come in, both naturally and in supplements. So you can have ionic forms, and we can have colloidal forms, we can have salts, and we can have chelates. Iron is not on its own. It's in I suppose, a protective packaging. Whereas iron salts are basically ionized or in a crystal form. Now, the reason we make the distinction is that the heme iron apparently has a special line at immigration just for it. So all heme iron holding passport holders can rush through that line, apparently, unhindered with perhaps some assistance, whereas the non-heme iron is a lot slower. And that's because those absorption forms, they don't have special treatment in that sense. But there's an assumption there, and that is that the people who are eating the non-heme iron are eating a phytic acid or phytates that they get in their diet. And in fact, it's the phytates that slow down the non-heme iron. So it isn't that that pathway is necessarily slower, because if you took iron foods or supplements without the phytates, it'd be pretty quick. So the phytates, if we're looking at the sources of them, cereals, corn, wheat, barley, rice, and related products like wheat bran, wheat germ. Then we have the legumes, beans, lentils, peas, and we have the oil seeds, sunflower seeds, soybeans, sesame seeds. These are the seeds that you can make oils with. And then we have nuts, hazelnuts, walnuts, almonds, cashews. You're probably going to say, well, they're the things that people are going to be eating in plentiful amounts who don't eat heme iron. For instance, a falafel kebab with the tabbouleh and the lemon juice, it's about 11 milligrams of iron in there. It's non-heme iron, but if in the right situation, someone might absorb a lot more than that they would the 3.2 milligrams from a beefsteak of 100 grams. So it's not a given necessarily that heme iron is absorbed better or faster. It's just that the diet that contains non-heme iron has some limitations of how much iron can be absorbed. But if we're talking about carnivores' iron intake, and you take, say, a steak, the amount of heme iron in there is about 50%, which means that 50% of that steak is non-heme iron. So it's not necessarily that the steak might have an advantage in the non-heme iron. It's just that the total amount is a significant amount for, say, 100-gram steak. So don't think that animal products like beefsteak are only heme iron. They're not. Now, how can we measure the iron? Well, you can measure the serum iron, you can measure the transferrin, you can measure the saturation, you can measure the ferritin, you can do a bone marrow examination. And one thing that's for certain, people rely on ferritin way too much for diagnosis of iron deficiency. If it's low, that's pretty good evidence. But if it's normal, you can still have iron deficiency. And the reason I know this is I did 6 months as a hematology registrar. So we used to go and see the patients, take a sample of their bone marrow, go back to the lab, stain it, and look at it ourselves. And so many times we found no iron staining in those bone marrow cells, and yet the ferritin was normal. And when I would ask the consultants which is the best um, measurement of iron, they'd say the tissue sample is the gold standard. The ferritin is misleading. And this has been borne out in a few other studies too. For instance, in restless leg syndrome, you can tune the MRI to pick up iron density in the body, and you can tune it to see whether the iron levels are low, normal, or high. And what they found is that the blood ferritin overreads what the brain has in terms of iron. And so, where this went was they gave these patients iron for their restless legs based on these MRIs, and their restless legs got better, proving the ferritin was misleading. So, um, even different parts of the body utilize iron differently. We'll come to that. The well-known bit is if you read any textbook, even Google will say the major function of iron is to transport oxygen around the blood. Well, that's not actually correct. A fair bit of the iron is actually stored in the mitochondria. And those mitochondria, we'll talk about them in a minute, they hold a lot of iron as well. So in fact, the red cells are not necessarily the largest source of iron in the body. So why we're talking about this is the hemoglobin, where the iron is situated from heme iron, has 4 iron atoms, and it can bind oxygen. So when it goes through the lung, it binds the oxygen in the lung, goes through the bloodstream, gets to its destination, releases the oxygen to the tissues, and goes back for another round. So in the cells, those red cells, there's about 270 million hemoglobin molecules, and that means if each of them can store 4 oxygens, then each of them has 4 ions. That means that there's about 1 billion iron atoms in one red cell, and there are something like 30 trillion red cells. So what other tissues would have the iron? Well, we've already mentioned the brain. And what's interesting about the brain is the glial cells, glial meaning glue in Greek, feed the nerve cells like nannies, and they actually store iron as ferritin. The iron metabolism is different in the brain. Even nerve cells store iron as ferritin, and that shows you how important it is for the brain, not just the blood cells. I mean, if the brain cells weren't there, it'd be a complete waste of time traveling, sending oxygen around the bloodstream. The heart has a very high level. Liver, testicles, bone, even. That's something that a lot of doctors don't realize how much iron is in bone. Adrenals, even the thyroid. And as we talk about the role of iron, it'll become more clear what these things do. So the majority of the iron is probably in the mitochondria. So there are 80 trillion cells and about 100 trillion mitochondria, and the mitochondria have lots of iron that is not heme based. And this is why a steak, because it is a muscle fiber and has lots of mitochondria, between 2 and 500 mitochondria per cell, that muscle, a lot of the iron in it, the steak, is actually in the mitochondria. Half of it's in the mitochondria. It's not in the myoglobin. So we've talked about the red cells, their funny shape. They're supposed to be exactly like a donut that's been filled in the middle. They can swell to larger sizes, but one of the hallmarks of the iron deficiency anemia is that they get smaller. It's because there's less hemoglobin packed into them. But we have over 600 muscles, probably 640. And if you total them up, they weigh about 4.6 kilograms. So you imagine that's a lot of steak. um, with 50% of it being non-heme iron. So we have a vast amount of iron stored in muscles. And that's one of the reasons people get fatigued with iron deficiency, because there's not enough iron in the mitochondria to generate muscle for the power of those muscles. So one of the problems we have with iron, on the good side, it can do a whole lot of things. On the bad side, it's a little bit tricky to deal with because there's a concept called electronegativity, where as you climb up these electrical potentials, the effect of the iron or whatever it is that's charged makes it harder to deal with in the cell because of the oxidative stress that it creates. So you can see here sodium, potassium, calcium, magnesium are relatively benign, low electronegativity. As you climb up, you start to see zinc and then iron just before hydrogen ions or acid or protons. They're all equivalent. So the problem is that iron's quite reactive. And apparently, according to Professor Berlinski, the single most successful strategy to prevent hydroxyl radicals or free radicals was the ability to hide the intracellular metals. That's because they are constantly snitching or moving electrons through the cell. And when you move electrons, you have electricity. And if you move too much electricity, you get electrocuted. So one way I think of it is this, that the metals inside the body, copper, iron, zinc, manganese, molybdenum, cobalt, vanadium, etc., they're a bit like knives in the kitchen. You take them out, you use them, and you put them the hell back because you don't want them floating around causing a problem. And part of the balance issue is keeping iron and copper in check. This is a very old diagram, and it's from somewhere in the 50s, where we were still calling lymphoma lymphogranulomatosis. And what it's doing is comparing the serum copper and the serum iron in all of these cancers, and in every single one, chronic leukemia, acute leukemia, lymphoma, lung cancer, and stomach cancer, every single one, the copper is higher than the iron. When we do the lecture on iron and copper, I'll explain why this is so important. So you want the iron to be, at least in the normal range, or at least in balance with something like copper. One of the reasons why we have these intracellular minerals is that they act as antiseptics. And if you can imagine these test tubes, and this is the level inside the cell, the higher they are, the better the cell can repel anything that might want to live in it. So intracellular parasites and viruses, for instance, are small enough to evade the immune system, get into the cell, and then hide in there. It's a bit like a burglar hiding in the house while the security patrols are driving outside. They don't want to go in unless they have a really good reason. So the level of copper, iodine, and iron. And so if you look up what iron deficiency costs this country, it's about $1 billion a year. And one of those reasons is infections and days off work from infection. Notwithstanding depression, fatigue, cognitive disorders that lead to home accidents, car accidents, work accidents, playground accidents, etc. It's a significant cost. So that's just one of these intracellular antiseptics. Now, when it comes to where are we going to get the iron from? I mean, obviously, the core of this planet is iron, and we can't go down there to get it. And we have significant reserves of iron. I mean, think of all the iron ore that this country sells to other countries. So there seems to be plenty in the rocks, but it might not be so much in the topsoil. So we have our soil levels and we farm these things. So, for instance, wheat should be a significant source of iron. Even, would you believe, tomatoes should be a good source of iron if they're grown organically. And then we process this and then we store them. And storage introduces a whole lot of problems like shelf life, preservatives, food colorings, etc. And in this country, Australians consume 5 kilograms of those every year: preservatives, food colorings, um, and preservatives, food colorings, and other additives. And then you choose what you're going to buy. So dietary choice is really important. So here we have the perennial argument between the carnivores and the rest of the world. How much meat should one eat? I don't know if there was a program, I think, on SBS about this, and they had experts from all over the world, and none of them could agree. Once a week, twice a week, it's certainly not 3 times a day. So then we're at the mercy of the absorption. Now, this is where things like the heme iron can cross the fast lane, and the non-heme iron has to get in with the plebs of the passport holders that are not of that country. But there are other hurdles as well, and we'll come to that. And then the iron has to get across the cell membrane. So I simplified this, but the first membrane is obviously the intestine, and then has to get through the liver, and then it goes out in the bloodstream and crosses into the cell. So there are a lot more hurdles than just the simple "you are what you eat." In fact, I don't think it was ever that simple. So who's going to help us? Actually, the reason we've got 700 grams of gut bacteria is that they're migrant workers. They can get a visa to work there, as long as they do stuff. They have to prove their employment, the worth of employment. So they are unloading the vitamins and the minerals and the sugars and the amino acids and the fats and everything, awaiting courier delivery to the final factory. If they like you, if they turn up for work, and if there isn't any other agenda to what they're doing. So this is the gut bacteria being helpful or not. For instance, lactobacilli species can control iron absorption. They can actually slow it down if it's too much. So they have a fair bit of power as to the control of this. It's not all the upper gut stuff like the stomach. A lot of digestion has components related to further down the small intestine and the microbiome. Well, one way of looking at the iron levels is, well, what's your intake? So it may be so many milligrams per day, depending on what you're eating, and whether you have any uh, blockade to that sort of thing. And then we have things like antacids, proton pump inhibitors, coffee and tea. I remember I had a patient who needed to have 1 or 2 iron infusions a year, and finally she said, "Look, I've given up coffee, just one a day," and her iron levels were stable after that. So it's, you know, there are actually reasons to give up those things if you're struggling with iron. High dairy intake, and I've added this to this chart since I did this a few years ago, glyphosate. Now, there are patients who are chronically iron deficient. They're not bleeding from anywhere. They've got some sort of menstrual control or the postmenopausal. They've been scoped from the top, scoped from the bottom. They've had their feces analyzed for occult blood, and the gastroenterologists, hematologists, and GPs are scratching their head. I would implore those people, when you get to that point, to actually do glyphosate level in the urine. And that is, if you look at the data, this is just one of the examples. Deficiencies in iron, cobalt, molybdenum, copper, and other rare metals are associated with celiac disease can be attributed to glyphosate's strong ability to chelate these elements. And this is from Ecotoxicology and Environmental Safety from last year. There are more studies like this. So all these people know about iron deficiency and glyphosate. We need to spread the word to the people who are also dealing with it. Now, iron can change depending on the situation. And the reason is that when there's an infection, the default state of the immune system is to assume it's a bacterium. So the first thing you do then is you hide the iron because the bacteria are looking for the iron. That's the spoils of war. So if you can hide the iron, they get very irate and they basically die of attrition. So two things happen. You hide the iron in a canister called ferritin just for a little while, and then you raise the copper level because copper is a natural antibiotic. And that's not making therapeutic claims. That's actually in every biochem book that copper has antimicrobial properties. So ferritin's like a canister for iron. The more iron you have, the more canisters you need. We'll come back to this a bit more, but it turns out that you can put other things in the ferritin canister, like lead and mercury and aluminium. So it's not a given that when you measure ferritin, it's actually full of iron, because it might not be. But what happens is the ferritin level goes up and down depending on the inflammatory state. So in the normal state, ferritin's just floating around its normal sea level. But during inflammation or infection, the high water mark, the ferritin will go up. And then when things settle down, it goes back to normal. And then when you get inflamed, it goes back up again. So imagine this scenario. Someone who's been getting recurrent infections, fatigue, finally turns up with a really bad flu, and they say, "Oh, doctor, while you're there, can we check my iron levels?" And they all come back normal. And the doctor says, "Well, see, you're being silly. There's nothing wrong with your iron." So, where to look? Okay, so fair enough. We do have to exclude if somebody's bleeding. And the blood loss isn't just like blood squirting out the bottom end. It can be very slow and incremental and not even show a change in the color of the feces. So we need very sensitive tests. And what the tests look for is actually hemoglobin. Um, could it be that they have low levels of beneficial bacterium, especially the lactobacillus species, as the cause of the persistent iron or the recalcitrant or recurrent iron deficiency that seems to baffle everybody? Then we've got worms, hookworms, whipworms, and roundworms. They're the famous three that can either cause you to bleed slowly or actually grab the iron and embezzle it. Then we have vitamin C deficiency. And I'm sure there will be people out saying, "Oh, there's no way we see vitamin C deficiency in this country." Well, I would invite you to come to my clinic and see the hundreds of blood tests showing vitamin C deficiency that I've found. And those often explain why a person's had recalcitrant and resistant iron deficiency. You don't sort of think about it until you give iron and go, "Oh, you have to give it with vitamin C." But then no one ever think, "Oh, maybe I'm vitamin C deficient and that's why I'm not absorbing the iron." It also turns out that, well, in terms of the vitamin C, it's basically like giving a leg up to iron. But it also turns out that vitamin D has an impact on iron levels as well. That's something that people don't think of. Then we've got zinc deficiency. Is there a zinc deficiency at the basis of this? I can't stress enough the importance of zinc when it comes to the absorption of iron. And the reason is that iron, being a charged atom, is better absorbed in that way. The same with calcium and magnesium. So we need the zinc to create the stomach acid to then create an ionized atom which is better absorbed. This it's not that necessary for the heme ion. We've mentioned that glyphosate has been proven to chelate iron, which means it locks it up in the gut, which means that you can take all the great supplements you like and you will not make any headway while you still have glyphosate in your gut. So, glyphosate, don't check the iron levels when you've got acute illnesses or inflammation. It will mislead your doctor. And then the last thing, if you have something like thalassemia, which is a disorder of the hemoglobins, uh, there is a way to tell whether the um, low MCV is due to iron deficiency or due to the thalassemia if the iron studies are unhelpful. But it's better to get a doctor to assess that for you. Don't guess or Google it yourself. So I hope you got some good insights from watching this. I mean, 12% of this global population have iron deficiency.